Well, hello. It's Bruce Williams, and it's Friday, so it must be time for another Gross Path Challenge. This one's Gross Path Challenge number 29. And as I do at the beginning of all of my lectures, I want to thank my friends and colleagues who have provided me images, either directly or through online collections, which allow me to put these little exercises together. So go ahead and get out your pens and your papers and give yourself 60 to 90 seconds per slide, and let's begin. Slide number 1 is from a dog. I'm going to ask you for 2 morphologic diagnoses on this one. Okay, time's up. There's actually probably 3 morphologic diagnoses or 4 morphologic diagnoses, but let's look at the most important one, and that's the presence of this mass within the trigone of the bladder and maybe extending down into the proximal urethra. And when you see something in that area, it's almost always going to be a urothelial or transitional cell carcinoma, 2 names for the same entity, a very aggressive, widely metastasizing, highly invasive neoplasm of the dog. Normally this one arises in male dogs in the area of the prostatic urethra. It's the number 1 most common site because it's so infiltrative. A lot of people, I think, over the years have misdiagnosed prostatic tumors when they're actually looking at urothelial carcinoma. If you run a uroplakin, and I strongly encourage you, whenever you have a prostatic malignancy, to run that uroplakin, you'll find that a very significant percentage of them are actually arising from the urothelium. Okay, so that's number 1. Number 2, if you look at the wall of the bladder, it appears very thick. There's an exudate in the bladder. I would imagine this animal had a lot of urine retention, probably had chronic irritation, maybe some chronic bladder infection. So a proliferative cystitis might be another morphologic diagnosis. The one that I hope that you jumped on because of the presence of this neoplasm in the trigone of the bladder where the 2 ureters dump into is bilateral hydronephrosis, as these calyces and the pelvis are highly dilated. If you want to say hydroureter, I bet there's a degree of that as well. And then the final one you can see, at least on this side, is that there is a lot of inflammation around that dilated pelvis. The cortex has some streaking in it. It's an abnormal brownish color, and this animal would have a chronic suppurative pyelonephritis at least. So that's 4. I think the 2 big ones that you should absolutely get would be the presence of the urothelial carcinoma and that hydronephrosis. Those 2 go hand in hand when the bladder sits in the trigone. Okay, number 2 is tissue from a cat. How about a morphologic diagnosis and a cause? Give yourself about 60 seconds. Okay, your 60 seconds is up. Boy, does that go by fast. We're looking at multifocal areas of abscessation within the spleen. You can see that they are raised over the capsule. So we've added cells, we've added neutrophils, a lot of cellular debris. It's not just necrosis. It's going to be some suppuration as well. My morphologic diagnosis is multifocal to coalescing necrosuppurative splenitis because I've combined those 2. I know that these areas started out as areas of necrosis, and then the presence of necrosis has recruited a lot of neutrophils to clean them up. When we see this pattern in any animal species, you want to think about hot gram-negative bacteria, which when they get into the body, they zone in. Especially if they come in orally, they go straight to the lymphoid tissue in 3 main organs: the ileum, the mesenteric lymph nodes, and the white pulp of the spleen. And if you took a section of the spleen, you would see that most of these, if not all of these areas, are pre-existent areas of white pulp which have been wiped out and replaced by cellular debris. The number 1 hot gram-negative that was going to do this in a cat is going to be Francisella tularensis. They'll do this in a number of other species too, including rodents and rarely people. Number 2, how about Yersinia? Yersinia enterocollitica or Yersinia pseudotuberculosis do the exact same thing. Give these lesions, but they're going to have nice big bacterial colonies that you can see at very low magnifications. That's what makes your Yersinia special. A couple of other ones I guess you could probably think about, maybe something like salmonella. Really hot salmonella can do this as well. But this is the province of hot gram-negative bacteria, this multifocal splenic necrosis. Okay, slide number 3. We're going to stay with cat. And this is tissue from a cat. Great picture by Gordon Andrews and Brian Caserto. And I want you to give me a morphologic diagnosis and 2 other lesions you might see in this animal. Okay, time's up. This is a great picture. People call this lesion Pumice Stone because it's sort of like those lava stones that you see in the bottom of a charcoal grill, also known as pumice stone. Pumice stones have been used for many years to sort of sand things down, especially if you had a corn or a bunion on your foot. You might rub the surface, the excess skin off of it with a pumice stone. And this, if you squeezed it, it would be a little crackly because there's a lot of mineral. This is Uremic Pneumonitis. And so the morphologic diagnosis would be multifocal coalescing alveolar septal mineralization and edema. This is about the worst thing that can happen to your lungs, because when you mineralize those alveolar septa, you're certainly not going to be able to pass any air across them. Just a little bit of mineral, and that alveolus is useless forever. You often have a concomitant mild vascular degeneration, and so you also flood it and surrounding alveoli with edema fluid. So it's a very bad thing. It's usually a terminal change in animals with uremia or anything that causes an altered ratio between calcium and phosphorus. Anytime you take the calcium number and multiply by the phosphorus number and you get over 70, the body is primed for mineralization in multiple areas. And any of those areas will qualify as the 2 additional lesions that I was looking for. So if you said there was mineralization in the intercostal muscles, in the gastric mucosa, in the kidney, that would all be acceptable. Other things that you might see in this animal would be parathyroid hyperplasia, okay, because the parathyroid is trying to get that phosphorus level back down, so it's going to secrete a lot of parathyroid hormone. And you might also see lingual infarction. So just any 2 other lesions associated with chronic renal damage would be acceptable as answers here. Okay, slide number 4 is tissue from a foal. How about a morphologic diagnosis and a cause? Okay, we're looking at a kidney. And it's the right kidney because it reminds me of a heart or a Valentine's that you would give. And that's the right kidney of the horse. Looks like that. And we can see these areas of white that are bulging from the surface. And so those are small abscesses as well. And when you think about this pattern of abscessation in the kidney of foals, it could be due to a lot of different gram-negatives, but the one that should jump to mind, something that used to be called Shigella E. coli, now it's Actinobacillus E. coli. And this particular agent causes abscesses also in the liver, you may see it in the spleen, a number of visceral organs, you see it in the lung, but a very characteristic pattern in the cortex of the kidney. It starts out in the glomeruli, and then you'll get suppurative glomerulitis, and if you catch it just at the right stage, you're going to see that all the abscesses are involving glomeruli. Very glomeruli specific. Eventually, glomerulus is going to just get too full of pus and rupture, spilling contents into the surrounding tissue. But you're going to see the abscesses in multiple organs of this animal's body. It's a classic disease of foals, Actinobacillus E. coli. Slide number 5 is a great picture from Dr. Kim Newkirk of the University of Tennessee. This is tissue from a broiler chicken. And I would like for you to give me a morphologic diagnosis, the cause, and give me another histologic lesion in this animal. Okay, time's up. Morphologic diagnosis, jumping right at you, right in the center of the picture, is hydropericardium. Now, when we think about hydropericardium, and a number of animals or accumulation of fluid in the pericardial sac, you want to think about degeneration of the heart muscle. Chickens more commonly will get ascites. Most of those degenerative heart lesions will give profound ascites. That's not what we're looking at here. We're looking at an infectious cause of hydropericardium, an emerging disease that's popped up in the last 15 years around the world, and this is due to avian adenovirus, the old type 1 avian adenoviruses. The other lesion that classically and for many years this group of avian adenoviruses in chickens has caused inclusion body hepatitis. So the other lesion I'm looking for is multifocal coalescing necrotizing hepatitis, and you'll see beautiful inclusions in the liver. These animals are often co-infected with immunosuppressive agents. Chickenemia virus is one. If you want to go old school, the Burner virus that causes Gumboro disease also can be identified here. You can see traditionally until the last 15 years, we just saw the inclusion body hepatitis. Now you can see hydropericardium independently, or you can see a combination of both. Avian adenoviruses also cause in broilers a syndrome of erosive ventriculitis or gizzard erosions, and there is a necrotizing pancreatitis that's been documented with avian adenoviruses. So, hydropericardium inclusion body hepatitis syndrome in poultry. It's common, it can be devastating, and something that we all need to know about. Slide number 6 is tissue from a dog. I'd like 2 morphologic diagnoses on this one. Okay, time's up. Well, the liver's orange. That's never a good thing. It's not your normal liver color, and if it wasn't orange, we wouldn't see the second lesion quite so well. But the orange color in the liver is diffuse hepatic lipidosis. Hepatic lipidosis can be the result of a number of conditions. In dogs, can result from hyperadrenocorticism, can result from diabetes mellitus. Sometimes you see it in animals that have been given large doses of steroids, iatrogenic steroid administration, the so-called steroid hepatopathy. So those are all possibilities. The lesion that I want you to, the other lesion that I want you to see are these sort of raised lesions. Some are actually somewhat depressed, but they're flat neoplastic macules on the surface. This is a Maggio Sarcoma. Sometimes they're raised. If the endothelial cells are present in really large numbers, or they're a big plump epithelioid type, then the lesion is going to be raised over the surface. But remember, endothelial cells are also very small and thin, and if you only get a couple, you're going to actually lose volume. So hemangiosarcoma may appear as depressed red areas within the liver. So don't get tricked and say that that's necrosis. Always think about the possibility of hemangiosarcoma, one of the most common malignancies in the dog, and it arises in 3 organs: liver, spleen, and the right atrium. Okay, we are doing great. I think we're already on slide number 7, and what a cute little goat. But what I want you to give me is a morphologic diagnosis and a cause. This really cute little goat in the picture is from Dr. Ildiko or Delyi at the University in Budapest. Okay, time is up. We see these bulges. It's a young animal, and this is bilateral thyroid hyperplasia. If you wanted to, in parentheses, put goiter, that would be fantastic. This is a young animal, And so this is a congenital goiter, and the problem with that is that the mother was getting either too much iodine or not enough iodine. And a lot of times it's too much iodine. This might be from having a number of plants within the diet, which are from the brassica family, so rape or kale or cabbage or something like that, may result in congenital goiter. This one's not so bad. I like to think that this animal's just sleeping, and it's not. This is not a post-mortem specimen, but it's not bad. Sometimes you'll see them; they're cystic and they're absolutely huge, and they contribute to goiter and to dystocia in a number of ways. Sometimes just the sheer size of these tumors may result in or contribute to dystocia. Also, animals that are hypothyroid will tend to parturition will tend to be delayed. There's retained placental membranes, and when you delay parturition, those animals, especially babies at the end of parturition, they tend to put on a lot of weight, and so when parturition is delayed, there's a much higher incidence of dystocia. The other thing that you will often see, because thyroid hormone is very important for a number of features, but the animals that are severely affected will be sparsely or not haired at all. This one has a very nice haircut. So this one, left to its own devices, if there wasn't something else going on, might have recovered from this. Okay, slide number 8 is from Professor Antonio Fernandez, and it's a great section through the head of a goat. And all I'm going to ask you for on this one is a morphologic diagnosis and a cause. Okay, time's up. Cause, I think most everybody's going to get. This is estrus ovus. You can see this in the sinuses of sheep and goats. Fairly common. It's a bot, which is the larva of a fly which lays its eggs in the nose. They crawl up, they get all into the sinuses. Very rarely they will pass through a cribriform plate, and you can find them migrating underneath the calvarium. They tend to cause a lot of irritation. Animals will stomp if they know that the flies are in the area. They'll lower their head to the ground to make it more difficult for the flies to lay their eggs. You can also see this in some free-ranging animals like deer. The genus there is Cephanomyia rather than estrus, and that's O-E-S-T-R-U-S, not E-S-T-R-U-S. The morphologic diagnosis might be a little more difficult to get to because these animals don't cause a lot of problem. But whenever you have any type of parasite on a mucosal surface, as we do here, whether it's a nematode, whether it's a fluke, whether it's an arthropod parasite like this, just the irritation will cause the secretion of some mucus, a little bit of inflammatory cells, some serum, maybe a little fiber, and you put all that stuff together and you have something that's called catarrh, C-A-T-A-R-R-H, and so that is a very handy and useful term for the inflammation that just the presence of these parasites will cause along mucous membranes. So a focally extensive or diffuse catarrhal nasopharyngitis would be very appropriate morphologic diagnosis for this. Okay, only 2 slides left. Slide number 9 is tissue from a dog. I would like a morphologic diagnosis. Okay, time's up. A great picture. This is from Dr. Taryn Donovan. And you can see that there are these little bumps all over the inside of the bladder lining. And this is a type of inflammatory change that's seen in chronic infection in the bladder. And what we're looking at are small little lymphoid follicles. A lot of the proliferative lesions that we see in association with chronic bacterial infection has to do with a marked thickening of the bladder wall. And there's probably a little of that going on here too, but the most important and the most striking feature are these little dit dots on the surface. These are lymphoid follicles, and the morphologic diagnosis is a diffuse follicular cystitis. This is not a very common lesion, but when you see it, boy, it sure is striking. So thank you, Dr. Donovan, for this picture. And finally, our last slide of the week, and you can start your weekend as soon as we are done here, is tissue from a great horned owl. That's bubo bubo. Great horned owl. And I would like a morphologic diagnosis and a cause. There's a little bit of pseudomelanosis here. That is just an incidental finding, not anything to be concerned about. And time is up. Okay, we've done a lot of liver and bladder on this, a lot of sort of necrotizing lesions. Okay, little white dit dots seem flat. These are areas of necrosis. They are pretty well demarcated from the surrounding tissue. So we have a multifocal to coalescing necrotizing hepatitis. Whenever you see this sort of pattern, we've talked about gram-negatives, and you want to think about that. Gram-negatives don't have a lot of, or birds don't have a lot of gram-negatives in their intestine. But these are areas of necrosis. And almost every species has some type of herpes virus that's going to cause necrosis in the liver. And in birds of prey, owls and other raptors can pick up a endogenous herpes virus from pigeons. This is columbid or pigeon herpes virus type 1, and can cause problems in pigeons, but also will cause problems in birds that eat pigeons. It's a considerable problem in owls, and you will see classic areas of necrosis in the liver, maybe in some other organs as well. It's a disseminated herpes virus, and one of those that jumps species. When herpes viruses jump species, nothing good is ever going to happen. So this is columbid herpes virus type 1 in a pigeon-eating owl. Okay. Well, that brings us to the end of Gross Path Challenge number 29. I hope you enjoyed doing these as much as I enjoy putting them together. And I hope that everyone will come back next Friday for Gross Path Challenge number 30. Everybody, I hope you have a great weekend.